So whenever we talk about all the five fingers, all the fingers are doing the representation of different elements. So we look at all the five fingers here. Thumb side is doing the representation of earth element. Or spleen, or we can tell spleen and stomach. Then the index finger and the side of the index finger is doing the representation of metal element, metal, or the lungs and large intestine. The middle finger is having connection with the fire, with the heart, with the pericardium, the middle finger. Regarding the ring finger is doing representation of wood element, or the liver and gallbladder, liver and gallbladder. And a small finger is doing the representation of the water element, or the kidney and urinary bladder. We already know this concept. Here, if I come back to the middle finger means the finger of doing the representation of fire, or the heart, or the circulation. So I would like to tell you some point in the middle finger. So till the 11.27 we already have discussed. You can go and revise in the previous chapters. So now I am doing the discussion, the point found in the middle finger, 11.28. So in the middle finger, in the middle joint, in the middle finger, in the middle joint, in the middle finger, we are having three joints. One is the lower joint, one is the upper joint, and one is the center middle joint. So we'll take the 2 point on the middle finger. And because this is the finger of heart, so these 2 points are very good for cardiovascular disorders, any disorder having connection with the heart. Cardiomegaly means enlargement of the heart. Angina pain means the pain in the chest cavity. And arrhythmia. What is arrhythmia? The heart is having a certain rhythm. So heart is beating all the time, lub dup, lub dup, lub dup, lub dup. Heart is beating 72 per minute. And heart is beating 72 per minute with a perfect rhythm. So the meaning of arrhythmia, when the heart is losing this rhythm, that is called arrhythmia. So let's focus that where the point located exactly. We already have discussed about the lines. In the finger, if we are starting from the other side, that is A line, then this point is located in the B line. Then there will be central C line. And again, one point is located on the D line. So these 2 points are located in the B and D line. So if you look at this image here, the point on the side of the thumb, the line on the side of the thumb that is called A line, the center will be C line. So the one line in between, that is B line, and one line will be here, that is the D line. So A, B, C, D, and other side we are having E line. In that way, we are having multiple line. Our points are located in these two lines, B and D. These 2 points are very good for all the heart related conditions. This is the middle finger and point located in the middle joint of the middle finger on the yin side, on the palmar side. Now, other than cardiac problems, as per the master tomb, if you want to do the treatment, if you are treating these 2 points, they are also having very good connection, and they are arresting the spreading of cancer, whether the lung cancer or the bone cancer or the throat cancer or the blood cancer. Leukemia means blood cancer. So all types of the cancer also can be arrested by these 2.11.28. Because when you want to stop the cancer, how the cancer is spreading, the cancer is spreading because of the energy of wood and fire. Like there is a fire, and if air is also there, then fire will be aggressive. So when we talk about the cancer, cancer become metastatic, like the lung cancer, like the bone cancer, like the throat cancer, any cancer, and spreading with very faster speed. How to arrest? Arrest the fire and arrest the wood. And when you talk about the middle finger, the middle finger is the finger of pericardium, and pericardium and liver are having very deeper relationship. So by putting the point in the middle finger, we are arresting the fire, mainly arresting fire. But the effect also moved to the wood. We also arrest the wood. So by using these 2-point unit, we also can work on multiple type of the cancer, and especially we can reduce the speed of spreading around. So only I will tell you in the conclusion, there are 2 indications. The indication number 1, this is a very good point for the heart, and the condition number 2, it's a very good point for the cancer. So look at here. Number 1, I told you cancer, and number 2, the multiple condition of the heart. And locating points is very easy task. If you look at my middle finger, in the middle finger, we are having middle joint. Yes, any cancer, all the cancer. In the middle finger, it's the middle joint. And on the side of the bone, on the B and the D line. So this is the B line, and this is the D line. we can they take the 2 points, and there's a very good point for cardiac products, right? No, we cannot just consider for the high BP. Definitely, we can use this point for the heart, but for the high BP, we have to find out whether some other, because high BP means you have to work not only just on the heart, you might have to work on the kidney, you might have to work on the heart, liver, multi gas. Right? We are discussing. We are having multiple points for the high BP, and they are just coming in the 44 unit. We are having wonderful point for the high BP. But if the high BP having association with the heart condition, and if we want to improve the heart condition, we can work on this point. If high BP is just because of the weakness of the heart, definitely we can improve the high BP also, because these points are one of the great points for cardiac problem. If the person is having high BP, you can put the black color here. If the person is having a high pulse rate, you can put the black color here. If you want to calm down the heart, you can put the black color here, right? In this way, we can work on these 2 points. As per the sujok, we know these two are the knee joint. We know that they are the arms, they are the legs, and the legs, they are the knee. So we are putting the strips or fenugreek, and it's working very good, nicely for the knee. Ultimately, here also, if you're treating the knee, you are treating the heart, you're treating the heart, you're treating the knee. If you're just treating the knee as per the sujog, if you're putting the methi strip around, it's also working on the heart. Even if just we put the 2 seeds here, we can work on the heart. Okay, now we'll move to the next point. In the same finger, yeah, definitely we can use them for the prevention. Yeah, yes, yes. Yes, it's good for tachycardia. Yeah. Now, in the same finger, I will be telling you another point. In the same middle finger. Now, I am going to do another point in this joint, right? We have taken the 2 point here. Now we will be taking the 2 point here, but not this side, but on this side here. So the same way of the point location, but in the lower joint, but this side. Now we will be making 2 point here. You can see how I'm making 2 point here. So first, the main question is how to locate the point here. First, I will tell you about the lines. So locate here. A line, then B, C, D, E line. This is the E line on the side. A, B, C, D, E. Then this is the F line, F. G will be center, then the H line. So F and H line, F and H line, 2 points. Okay, now then how to locate the point exactly? So look at the middle joint, look at the whole phalanges. Phalanges is from here to here. This is the full length of the phalanges, we can see. The full length of the phalanges, right? We can see the full length of the phalange. Now, I will divide this length from the half. So I've divided this length from the half. So I am taking the full length of the phalanges, lower phalanges, and dividing from the half. From this point, if I go 0.25 tune down, then this is the location of this point. Why I'm telling you in this way to search this point, otherwise you might go here, you might go here, right? You might wrongly put the point. So we don't have to put the point wrongly here. From the middle of the phalange, just a little down, means before the babe margin, we will find this point on the both sides. I will show you in the location. This is one of the great points. As soon as we are stimulating this point is stimulating a great circulation. This point is doing a wonderful circulation around. So now look at in this image. We can see here, this is the total length of the phalanges. We are dividing from the half. Then from there, we are going 0.25 tune down. Then we are drawing 2 points on the both sides, one here, one here. So this is called 11.30. Okay, actually, one side we are telling 30, another side we are telling 31. So it's not just about the number. Don't get confused with the number. Just try to understand. As soon as we are needing even a single point out of these two, they are improving great circulation. And they are improving great circulation, especially around the arms. First, they are improving the great circulation in the pericardium and the liver channel, because this finger is the finger of pericardium. So as soon as we are putting these 2 points, they are improving the circulation. And so that's why it's a very good point. If the person is not able to raise the arm because of frozen shoulder or because of some other problem, if the person is having frozen shoulder or the arm pain or the shoulder pain, not able to lift the arm, even the person is having paralysis and not able to lift the arm, we can take the help of this point. Mainly this point is working for the arm, but also removing the pain of the leg because of the circulation. So we can choose any one point here. There are 2 points here. We can see one by one. One is the 11.13 on the radial side. So it's a very good for hemiplegia, inability to raise the arm, or the frozen shoulder pain, leg pain. The another point on the other side, we can see here, 11.31, the same indication, right? Same indication. So in this way, just we have seen the point in the middle phalanges. They are very good for heart and their cancer. Then we have seen the point here. They are very good to improve circulation. So they are very good point for the frozen shoulder to raise the arm. Okay. So if the person is having frozen shoulder, what you can do? Even you can ask them, take the sujog ring, sujog ring, and put the sujog ring here, just do the massage on this part with the help of sujog ring. If the person is doing massage in this part with the help of sujog ring, and you will see the wonderful effect on the shoulder. Definitely we have to put this point on the opposite side. If the person is having problem in the right shoulder, we have to put point on the left side. So the main indication is if the person is not able to lift the arm, if there is a frozen shoulder, if the person is having leg pain, in this condition, it's especially working, and the person is not able to lift the arm either because of the frozen shoulder or because of the shoulder pain or because of the hemiplegia. In all the condition, you will press this point, then you can ask the person. Even you hold this point and do the gentle acupressure here on the opposite hand and tell the person, okay, now raise your hands, raise your hands, raise your hands. Definitely be able to put the point on the opposite side. The points found in the F and H line, F and H line. So we can see here, there's the F and H line. Because A line on the thumb side here, A line, A, then C will be center, E on the opposite side, then F, the first point will be in the F line, the center line is called G, then this another point is on the H line. So F and H line on the side. So just we have seen the point in the middle finger, and ultimately we are increasing the circulation. Even the person is having any condition of the shoulder pain because of the periarthritis of the shoulder, or there is a problem in the synovial fluid in the shoulder, or there is some frozen shoulder condition which is happening with a diabetic person, it will work. Because ultimately it will remove the blockages from the shoulder, and person will able to raise the arm, right? Look at this image. If you look at this image, you can see here how the middle finger, if you are doing the stimulation of the middle finger, how it's removing the blockages from the shoulder. It's having very deeper connectivity with the shoulder area. So this is the location of the pericardium one, which is going just next to the nipple, right? Just next to nipple. I will tell you, one of my patients was having shoulder pain. Then I have put these 2-point unit, just I told you here. Then I inserted the needle on the opposite side here. One point here and 1 point here. So he felt good improvement in shoulder pain. Then he could lift the shoulder. The ultimate problem, because he was not able to lift the shoulder, so I decided to choose this point. But also I did little acupressure before putting the point, and patient realized, okay, he's feeling good in the shoulder area. He was feeling good in the shoulder area, and even the arm lifting is more, but he was feeling little discomfort in this area on the right side after putting this point in this area. Then immediately what I did, I put one more point here, because 1 point already, this one which I just inserted here on the opposite hand. Then in the index finger, we know the point 11.07 or finger rapid horses. The very good for lungs and also very good for the cosmetic purpose. It is increasing the facial beauty and removing the black spots from the face. So on the index finger, we already know the location of these 3-point unit. We already discussed earlier. Then I put this point also. So 2 point here and the 3 points here, because these points also are working on the upper back, on the border of his scapula. Then patient felt wonderful. Just why these 5 points, or we can tell 2 points, 1 point here, 1 point here. So in this way, because it might may happen because I did very intensive acupressure before putting the point. So because of doing the intensive acupressure, the person felt very good in the shoulder, but little discomfort in the chest. But as soon as I put this point 11.07, then it was 100% comfort without any discomfort, right? So in this way, this point is very good, and we can combine with the other points. If we are combining with the 11.07, then 11.07, these 3-point unit, will take care entire lungs and the backbone and the scapula bone, and these points will take care the shoulder. In this way, this is a wonderful point combination. So only this much point I wanted to discuss in the middle finger. Now I would like to move to the ring finger. So this is the ring finger. And the ring finger is the finger of liver. We already discussed when you are putting the point in the ring finger, it is the finger of liver. So definitely we are going to put the point which will be very useful for the liver. In the ring finger, we are having 3 joints. So in the middle joint, toward the middle finger, we are putting 1 point here, just on the middle joint on the middle finger. And this point is good for liver. That's it. Only this much. The number is 11.29. I will show you in the other image. So if you look at this image, it's a very simple to find out. You can see here. In the ring finger, in the B line, A line will be on the side. The B line will be next. The C line will be in the center. So we are in the B line. In the B line, we are putting 1 point that is called 11.29. So in the ring finger, the middle joint, we are taking this line. It's a very good for all the liver problems. So like the hepatic disorders, the cirrhosis of the liver, hepatitis, liver cancer, and cholecystitis. So the meaning of coli means gallbladder. The meaning of cyst means bag. And the meaning of itis means inflammation. So the meaning of cholecystitis is when there is a inflammation of the gallbladder bag, gallbladder. Maybe it is because of the gallstone, and maybe because of some other reason. So whether the problem of the liver or the problem of the gallbladder, whether the problem of the hepatitis or the problem of the gallstone, in all the conditions of the liver and gallbladder, this point can be used. So that's why this is a very good point and very simple to locate. So again, you can see in this image how the point can be located. So these points are very simple, and these points has been added later on. if you see the old master tongue books, you will not find these points, right? But in the recent books, you might find these points. So look at here. In the ring finger on the middle finger side, this is the middle joint. In the middle joint, we have to draw the B line. So this is the B line, because A line will be on the side. A line will be on this side here. A line will be here, right? Then this is the B line. In the B line, we are drawing the point here, the point here. On the side of the bone, this is the point, very good for liver hepatitis, single point. Just you prick the single needle here, and it's very good for the liver disorders. Very simple point or not? Easy to locate? Easy to locate? Yeah, simple. So this is 11.29. Just prick the point very little, 1 to 2 fan, enough. 1 to 2 fan. 1 fan means 1/10 part near steroid. Yeah, sure. So last point I will show you here, then I will tell all the points once again. But before telling all the point once again, let's see the last point. The last point, I think these all the points has been added by the master tongue as per the consideration of some sujog, because master tongue was not telling sujog, because master tongue system is more than 2,500 years old. What do you think? Master tongue system is discovered by master tongue. What do you think? Master tongue system is not discovered by master. Master tongue system is discovered by the family of the master tongue. Since the 1,000 years they are practicing. Master tongue is the first person who shared this science to the world, right? To share this science. So we are telling it master tongue acupuncture. Now, these family lineage using all the microsystem, because we are having multiple microsystem in the human body, so they have selected all the points if they are working very fast, because there are many possibility of the points everywhere. But out of them, the points, they are working very fast. They have selected them and presented in the form of master tongue. Now, if you know the animal correspondence system, in the animal correspondence system, we are using the thumb. Maybe you are learning, you are doing the different type of the animal correspondence system, but I will tell you as per the master tongue. As per the master tongue, suppose we can see the animal having one eye this side, one eye this side. Like you can see the snake or python or dinosaur, anyone. The one eye this side, one eye this side. Okay, have you seen some movie when some animal dinosaur coming on the near window, then just one eye moving like this? Okay, have you seen some eye moving? Only one eye. So in that way, only he is having eye not in the front side, eye on the side, lateral side, right? Even like if words, you can see the snakes. I will show you. If you see any image of a snake, it is on the side. Look at this image. It is not in the front like us. Can you see this? It is on the side. So like accordingly, if we see the animal correspondence in our thumb. So this is the joint. We can see this is the joint. On the joint, one eye we are making on one side, and one eye we are making on the other side. Or we can tell on the A and the E line. See, dinosaur looking you from this side. Now see, this is the dinosaur who is looking from you this side. Okay. And this is the mouth. We can see this whole nail is like an open mouth. Right? So by consideration of this, if you are coming in the joint of the thumb, in the thumb we are having only single joint. We are putting 1 point on the A line, 1 point on the E line, 2.5 means on the side and on this side, A and the E line. And these 2 points are doing the representation of the eyes, and they are really very wonderful point of the eyes. Whether you want to treat the cataract, like opacity in the eyes, or the glaucoma, the high pressure in the eyes, or the nearsightedness, or the farsightedness, nearsightedness, farsightedness. Whatever the problem of the vision, if you want to treat, you can take the help of this point. So look at the image of this point here. So if you look at the image here, you can see the 1 point on the A line here, and 1 point on the E line on the other side. These 2 point unit are called 11.32. All the visual disorders, cataract, glaucoma, nearsightedness, farsightedness, blurry vision, dry eyes, flutters, this point is useful for all the problems. Right? So now let's see all the points one by one. Today we started the discussion with the 11.28 in the middle finger of the middle joint. 2 point on the B and D line. Because these 2 points located in the middle finger, so they are very good for heart. And the multiple problem of the heart, whether the cardiomegaly, the enlargement of the heart, or the chest pain or heart pain, or the poor circulation of the heart, or the disturbed rhythm of the heart. Second, they are good for cancer, all type of cancer. So this was the points found in the middle finger, 11.28. Then we directly jump to the 11.30 and 31. In the same finger, but in the lower joint, not in the yin side. Now we are coming to the yang side. So these points are located in the F and the H line on the side of the bone. Again, these points are very good for improving the circulation, especially they are improving the circulation in the shoulder joint in the arm. So if the person is not able to lift the arm, either because of the frozen shoulder or because of any arthritis of the shoulder or because of the hemiplegia, with the help of these points, we will able to lift the arm. These points are not only good for arm, but they are also good for the leg pain. So we have seen the 2 point here and on the front side, 2 point here. Now we are coming to the ring finger. In the ring finger, we have taken only 1 point on the middle finger side. Previously, we have seen the 2 point here for good for heart and cancer. Now we are seeing 1 point here on the ring finger, because ring finger is the finger of liver. So this point is useful for all the liver problems, whether the hepatic disorders, liver cirrhosis, hepatitis, fatty liver, liver cancer, or the any infection or the inflammation of the gallbladder. So this was the 11.29. So we have seen 11.28, middle joint of the middle finger, good for heart, cancer. Then 11.29, middle joint on the ring finger, good for liver. 11.30, again we are coming back to the middle finger, lower joint, young side, we can lift the arm, raise the arm. And 11.31, same point, one is 30, one is 31. Both points are useful for lifting the arm pain, frozen shoulder, even the leg pain. And the last point we have seen in the thumb on the both side, we can see the eyes point, 11.32. It's a very good point for all the eye part. Got it? Clear? So it was only few points, 29, 30, 31, 30, 28, 9, 30, 31, 32, 5 points.